Hi, I'm Kelly Vaughn, and welcome to Inside Indy. You know, it's a new year, so you may be thinking about a new you for the new year. That's right, it's that time of year, again, where we think about our New Year's resolutions and what we're going to do to better ourselves. And here in the studio to talk about that, to take us there, to meet our New Year's resolutions and beyond is Dr. Cameual Wright, VP, Market Chief Medical Officer for CareSource, Indiana. Welcome, Dr. Wright, to the show.
Happy New Year.
Happy New Year.
It's always so great to be with you, so I appreciate being able to come back.
I know, you've become a regular on these shows, and I love that.
It is very much appreciated.
Yeah, and we appreciate you. So, you know, I mentioned New Year, new you. Old habits die hard.
They do.
So, as a physician, what advice do you give viewers in terms of changing, doing better, eating better, staying healthy? What comes to mind for you?
So, I think that the new year is a new start, and we should definitely take some time to reflect on things that we did in the previous year and identify things that we might want to improve. I don't like the term New Year's resolutions because we kind of joke about them and then they're out the window in February. I really like to say, what are your intentions for the year? You know, so what are the things that you're really ready to commit to? And that might be physically, that might be mental health, that might be spiritual, that might be professional. I think we have all domains that we want to improve in. I really recommend people be intentional in identifying those things, but also be very realistic. So if you set 10 intentions for the new year, you're not going to achieve those more than likely. So I like, setting 3 to 5 goals and really committing to those. Most of the time, people will have at least 1 or 2 health-related goals. And as a physician, I certainly support that. So there are a couple things that I would really recommend.
Okay.
First of all, I think preventative health is really, really critical. So there are so many things that we can delay, if not outright prevent, with proper care. And so I'm going to recommend that everyone see their primary care physician. Whether that's your family doc, whether that's your internist, whether you see a nurse practitioner, go in for that critical preventative health visit. And that's important for a few different reasons. Number one, the first thing they'll do is they'll talk to you just like we're talking now. And I think a lot of times your provider can really tease out things that might require further investigation. So having a history taken and really having that conversation is important. The physical exam is also important, and oftentimes your healthcare provider can see things physically that may be of concern and may need further evaluation. And then I think your blood work is really critically important, and that becomes even more important as we get older. So you may have heard about knowing your numbers, and that is really, really critical because if we look at the causes of mortality, almost half of them, if not more, are related to some sort of cardiovascular health. So you want to know your cholesterol level. So there are a few different values involved with that. There's your total cholesterol. There's the good cholesterol, which is your HDL. There's the bad cholesterol, which is your LDL. And then there are your triglycerides. And so all of that is called the lipid profile, and that really lets us know basically the health of your blood vessels is a way to think about that. You also want to know whether you're at risk for diabetes. A couple different ways to detect that. One is your glucose level or your sugar level. And even better than that is something called a hemoglobin A1C, which measures your blood glucose control over a period of time. And your doctor can look at that and determine whether or not you seem to be at risk. You want to look at your blood pressure. Obviously, we want your blood pressure to be in the right range, and if it's not, certainly your provider can make some recommendations based on that. So getting that preventative visit, knowing your numbers, I think is one of the first things I'll recommend. But so little of healthcare happens actually in the doctor's office. Most of healthcare is what you do at home and those behaviors. So the second thing I would recommend is people really look at their behaviors. Healthy diet. I can't emphasize enough that your health is so dictated by what you eat. And food really is medicine. So we want people to have a healthy diet. We want it to be balanced. We really want to reduce the artificial sugars and the overall sugar content in the diet. We want to make sure that we're having plenty of fruits and vegetables, and we want to make sure we're having good, healthy protein sources and healthy fats. And so there are many, many, many different ways that you can accomplish that, but paying attention to your diet is critically important. Water is very, very important. So water is critical for your kidney health and for some of your other physiologic functions. It helps to flush out the bad toxins from your body. It's been shown to help with weight loss. It even helps you look good. So it helps with your skin health. And so lots of great reasons to drink water. Exercise is critically important. And this doesn't have to be getting in the gym and doing CrossFit. Something as simple as walking 30 minutes a day, or, there's so many different streaming devices and programs that you can bring an exercise class right into your home. So finding some way to be active, like I said, roughly 150 minutes a week. So that's like 30 minutes a day, 5 days a week, is really all you need. And again, it doesn't need to be vigorous, but you do want to raise your heart rate and you want to challenge your muscles. So those are things that I think are really healthy behaviors. You want to avoid the unhealthy things as well. So alcohol, you want to limit your alcohol intake. You want to avoid tobacco. And so that's not just smoking, but that's also chewing tobacco, that's also vaping, that's also secondhand smoke. So you really want to avoid those things. And then substance use is something that is becoming more and more common, unfortunately, and many people are challenged by that. If you find that you are having trouble with alcohol or drug use, there's so much help out there. So I recommend, again, seeing your healthcare provider so that you can get connected to some resources.
Okay. It's interesting that you talked about, preventative care and then just going to the doctor. And we were discussing that actually on another show about how so many people don't even have a primary care doctor.
Yes.
Why do you suppose that is?
I think that a lot of people in the United States think about going to the doctor when you're sick.
Right.
And so we think about sick care. And so what I think we really need to change the conversation to is well care. So you don't want to wait until you're ill to see the doctor. And a lot of people don't establish relationships with providers until they're not feeling well. What we want to do is we want to normalize having a primary care physician that you're building a relationship with, that you're seeing year after year after year, who gets to know you, who gets to know your health conditions, your body, etc., and then are best positioned to make those preventative recommendations, but also to help if things go wrong.
Right. Okay. Wow. It is so critical to have that. And as far as the preventative care and the follow-up, and I think about people sometimes. In fact, a friend I had two friends pass away. One of my best friends died.
I'm very sorry to hear that.
Thank you. Janice Cummings, great musician here in town, involved in ministry and that kind of thing. But it's that whole thing of, like you said, going maybe, and I'm not saying that she did this, but going to the doctor when we're sick as opposed to being taken care of all along. And when I hear of people being diagnosed with things, whether it's what she was going through or other people, another lady, a friend of mine on Facebook, I've just found out died of cancer. And it's like,
sorry to hear that.
Well, when did this happen? And you just wonder, when this happens to people, is it because they weren't going through that preventative care type process? It would have been caught, or they, I'm not feeling well, and then they went. And it just makes you wonder how often that happens. Like, why didn't they know? You're just angry, like you don't want them to be gone, but why didn't they know? How come they didn't know? And is that often the case, you think, that when that happens like that?
I think so many causes of death are preventable if you can get into the office and you're getting those regular screenings and you're regularly engaged. My grandmother died rather young, and just talking to my mom about family history, I learned she never went to the doctor. So, I feel like I missed out on her, right? Because maybe there could have been something that could have been prevented. That being said, unfortunately, there are things that just happen, cancer being one of those things, that come out the blue, and there's no warning, and there's not much that can be done. Mm-hmm. So there are things that will happen that we won't be able to prevent, but I think we need to stack the deck in our favor. Okay. And we need to do everything possible to address those preventable causes of illness and death.
I think some of it is fear, though, especially when you get older. Like, when I was 28, I'll go get my mammogram. I'll go. No big deal. Because I started mammograms in my 20s because people would say 40, and I had a friend in high school who had cancer, breast cancer, at 17. So I never listened to what they were.
Yes.
Nope. I got a friend. I'm going. But when you get older, it's like, oh man, what if they find? So, because you're thinking, the older I get, possibly the increase, the chances of me or anybody being sick might be real. So we're going to take a break. We're going to come back. And we're going to talk about that whole thing of getting older, aging, and that fear of going to the doctor. And we're going to share a little bit about Dr. Wright's weight loss journey. I want to hear all about that when we come back.
Visit aarp.org/caregiving for information on how to provide even better care for the person who wants to care of you.
And we're back here on Inside Indy, and we're talking about, she said don't say New Year's resolutions, but new life resolutions. How about that?
There you go.
And Dr. Cameual Wright is joining us from CareSource. So tell us about you. You walked into the Channel 40 lobby earlier before we began taping, and I saw right off the bat, you have lost weight. And I was like, did you lose weight? And you said,
yes.
Tell us about it.
First of all, thank you so much for noticing. I think weight and keeping weight down and keeping and taking weight off is a battle that many of us can relate to, and it's something certainly that I have struggled with my whole life. So even before I met you, I really struggled, and I've lost over 100 pounds in the last few years. And then most recently, since you last last saw me, I lost about 20 pounds. And I think, I would say there's no shortcut home. So going back to the principles I talked about earlier, it's diet, it's exercise, it's being engaged with your primary care provider, because we are fortunate to live in a time where we have advanced tools and techniques. So weight loss surgery is a great option for people who have really struggled. I personally had weight loss surgery. I'm a big proponent of it. It's not right for everyone, but I think that if you get to a point where you truly have done everything, it can be life-saving. In addition, there are lots of newer medicines that are coming out now.
Oh yeah, I've heard of about that in the news.
Yep.
Originally
Ozempic,
diabetic medicines, but yeah.
Mounjaro, the efficacy and the data of those medicines is incredible. And I think that we're starting to really win the fight. So again, no shortcut home. I've had my own personal journey. I would encourage people, do the things we talked about: healthy diet, exercise, positive behaviors. If that's not working, don't hesitate to reach out to your provider, because we have a lot of tools in our tool belt these days.
Wow, that's nice. And and people sometimes resent that. People who are not struggling with weight resent that. Like, well, all they got to do is just not eat. All they got to do is exercise and all that. And then but if I say I have high blood pressure, you don't have a problem with me taking a pill. But as soon as I say I want to take something for weight loss, everybody got a problem with it.
I couldn't agree more. If you had a problem with your heart, you wouldn't hesitate to take medicine.
But,
if you had a problem with your leg,
you won't need the blood pressure medicine, right?
to take medicine. But then people frown when you take medicine or you do other things to lose weight. But what we know is that the chances of dying from an obesity-related condition is almost 100%. So if something else doesn't get you before that, your obesity will kill you. And so why wouldn't you use every avenue?
Why not?
To try to prevent that? And I'm going to speak as a Black woman. Black women have the highest rates of obesity and the lowest rates of using medicine and surgery as a way out. And I think that we, people of color, need to know there are things out there that, again, can be life-saving. They shouldn't be your first resort. There are obviously a lot of other tools and techniques, but don't hesitate to ask for help. And I think this goes beyond weight. Don't hesitate to ask for help if you're really struggling.
Wow. I appreciate, first of all, you giving your testimony and opening up like that. And I think what frustrates me about the way society feels about weight gain or obesity is that, they just overeat. And that's not necessarily always the case. There are people that overeat. But I was watching on, I don't know what it is, TikTok or Instagram or something the other day, and there's this guy, and he's morbidly obese, and he's just running and exercising, and I'm not going to give up. And I'm thinking, and everybody's like, go, yeah, but nobody can sustain that. And that tells me chances are that isn't just you eating. There's something wrong. If you have to do that much, I mean, he was doing like a football player, and that's great when he gets to, maybe he can get to his goal, but to maintain that. So when you can't maintain that, there's something wrong, because most people don't have that kind of problem or gaining weight that quickly. So we get into things like insulin resistance. People don't talk about that.
There's insulin resistance, there's thyroid issues, there's mental health issues. So a lot of people have trauma. They have a lot of other conditions that contribute to obesity. A lot of medicines that you take to solve one problem will negatively impact your weight.
Preach.
There's so many different factors, and I think we have a lot of fat shaming in our society, and we judge people based on what they look like, but we don't know what their struggle is,
Right.
and we don't know what all the factors are. Once you get beyond a certain amount over your normal body weight, your chances of success without some sort of intervention become very, very, very low. Because if you have 20 pounds to lose and you lose a pound or two a week, you can stay motivated for a few months. If you have 100 pounds, 200 pounds to lose, and you're losing 1 to 2 pounds a week, it is so difficult to stay motivated in that journey.
For that length of time.
That length of time.
The dog gets run over by a truck, family members die.
Something is going to happen.
That can throw, because you got to be focused and, you have to make a concerted effort to do that.
And so people need, at the very least, support systems. And they may need other things as well. And we have to normalize people getting the help that they need, whatever that might entail.
There's a Dr. Piatek. I'm assuming he's still practicing. If you go down 465 going north or southeast, he's along the highway there, maybe close to 10th Street or so, or further south. And years ago, I actually had seen him, and he was on the cutting edge of all of that, using drugs to assist. There's one drug that causes, it's actually for depression, but they found that people they start acting like they're anorexic. I can't remember the name of it, but he used that with patients, and so.
Wellbutrin is probably what you're talking about.
Yeah, that's it. There you go. Because I had a coworker who said, "I lost 30 pounds," and again, I have this medically inquisitive mind, and I go, "What are you taking?" And she said,
Wellbutrin.
Wellbutrin, okay. And I said, I said, my doctor told me that causes the symptoms of anorexia. She couldn't understand why she lost weight, but he used that.
Yes.
And I hate to say it, a lot of people don't agree with me on this one. And again, we're getting into another show, and I'm gonna get back on topic, but HCG, human chorionic gonadotropin.
Yep.
Sorry, did it? Unbelievable. And in fact, the bariatric industry came out against it, but because it was so effective, because it was so competitive. So that's another show. But I've actually even done a story with CBS News about HCG being so phenomenal in terms of it. So there are other approaches.
There's so many approaches, and like anything, this is where the art meets the science. So I think that there's just a lot of, again, tools in the toolbox, and not everybody is going to need a medical intervention. But I think this is an area where open up the dialogue with your provider, see what's appropriate, and see if there might be help for you.
Okay. And I'll note that the HCG has not been approved by the FDA for that use, but keep in mind, too, that there are plenty of drugs on the market that have not been approved by the FDA, and they're still used to serve clients. So keep that in mind. Depends on your doctor and whether they want to delve into that, but they are, quote unquote, practicing medicine on you. So again, I just wanted to make that note that it was not approved for that. So what about exercise? How important is that in terms of on this road to a new lifestyle?
I think exercise is critically important. So what we're finding out is that, yes, it will help you lose weight, but diet is far more important in terms of losing weight. What exercise helps you do is, number one, maintain your weight. So exercise is going to be critically important once you lost that weight in terms of keeping those pounds off. It helps to strengthen your bones. And for women, again, as we age, bone strength and bone loss can be critically important. So exercise helps with that. It helps to build muscle mass, and it's our muscle that drives our metabolism. So here again, keeping our metabolism revved up will help us maintain that healthy weight.
Process that sugar.
Yes. And then something that I heard once that I really like to say is that exercise is the most underutilized antidepressant out there. So exercise has a tremendous effect on our mood. So if for nothing else, no other reason, it helps us with stress relief. And it helps us, have a healthy outlet to clear our mind.
Okay. We've got just about 2 minutes left, so I'm going to hit these bullet points here.
Yes.
Okay, sleep. How important?
Sleep is very, very important as well. Lack of sleep in the short term can affect the way we think, can affect the way we concentrate, can affect our mood. In the long term, it can contribute to chronic disease like obesity, like heart disease, etc. Critical to get that rest.
Okay. Creative substitutions for unhealthy foods. I swear I feel like I'm talking to myself when I talk to you. Go ahead, go for it.
You know, you want to really, snacking is fine, but you want to gravitate towards fruits, vegetables, healthy proteins. Like you can have some chicken breast if you want, boiled eggs, veggies dipped in hummus or guacamole. Those are healthy things. Stay away from the candies, the chips, the soda. Those things can be very unhealthy for you.
Now, when I have that sweet tooth in the evening, sometimes I'll make just hot chocolate, but sweetened with stevia. And yes, the milk has some carbs in it. The stevia has no carbs, but it's better than going and getting a milkshake from Steak and Shake or something. Now, I like Steak and Shake, don't get me wrong, but I'm just saying that, consider the number of calories and the sugar in that as opposed to just having a hot chocolate.
Absolutely.
Or cold chocolate milk.
Or you can make a nice protein smoothie.
Yeah.
So, you take some almond milk or oat milk or regular milk if you drink that, put a little frozen fruit in there, maybe add a little protein powder.
Yogurt.
It'll hit that, some yogurt, you can do cottage cheese in there. It'll hit that sweet tooth, but in a healthy way.
Yeah. Okay. Well, we are so proud of you. Number
Thank
one, just
you.
doing what you do, serve the community, and congratulations on your weight loss. And
appreciate
though we
that.
love you just the way you are,
I
little
love
Billy
it.
Joel there, Dr.
I
Kevin.
have to come back and be serenaded again.
I see. Thank you so much for being a guest on our show.
Always a pleasure. I appreciate it, Kelly.
All right. And thank you for watching. I'm Kelly Vaughn, and we'll see you next time. Bye-bye.
When I was in foster care, I never knew when I would have to move. So I always had my suitcase ready to go. Then one day, I was adopted. My new parents opened their hearts and home to me. My parents cook my favorite breakfast for me every morning. My parents take me on trips I never thought I would go on. They gave me a home and an even better reason to use that suitcase. My parents aren't perfect, but they're perfect for me.